My workshop presentation is on HIV/AIDS among the youth aged 15 to 24 years. Young people are the center of the global HIV/AIDS pandemic. They are also the world's greatest hope in the struggle against this fatal disease. Today's youth have inherited a lethal legacy that is killing them and their friends. An estimated 11.8 million young people aged 15 to 24 years are living with HIV/AIDS. Each day, nearly 6,000 young people between the ages of 15 and 24 become infected with HIV, yet only a fraction of them know they are infected. More than 2 decades into the epidemic, the vast majority of young people remain uninformed about sexually transmitted infections. Although a majority have heard of AIDS, many do not know HIV/AIDS. Many do not know how HIV is spread and do not believe that they are at risk. Those young people who do know something about HIV often do not protect themselves because they lack the skills, the support, or the means to adopt safe behaviors. HIV/AIDS has its roots in a range of problems that undermine people's health and human rights, such as inequity, discrimination, and poverty. To achieve widespread implementation of preventive interventions, many things will need to be done through many sections and by many sectors. At the same time, it will be important to ensure that these interventions reach the people who are vulnerable and most at risk of becoming infected with HIV, both in terms of where the virus is and where the virus is going as the pandemic develops and matures. Young people make up a segment of the population that is particularly vulnerable to HIV. Altogether, 50% of HIV transmission takes place among those aged 15 to 24 years. In recognition of young people's vulnerability to HIV/AIDS, the United Nations General Assembly Special Session on HIV/AIDS has outlined a number of goals and targets focusing on young people aged 15 to 24 years. Okay, now let's discuss about the major issues and challenges for HIV prevention and treatment. Despite the progress that has been made, still many issues and challenges are unidentified either program management level or services seeking level, the ultimate level. The ultimate goal is to identify those issues and challenges for the effective response. For example, limited coverage of HIV testing and counseling. Counseling services have a pivotal role in HIV/AIDS care. HIV counseling and testing is a major starting point for assessing and being informed of HIV/AIDS related services which provide psychological support. Secondly, health systems constraints. HIV/AIDS poses a challenge for health and social systems. Although positive steps have now been taken by the government in combating HIV/AIDS, still numerous challenges remain. One issue is the structural inadequacy of the country's current health care systems that has geographically been revealed. Now, what are the possible solutions to curb the spread of HIV/AIDS? The government is committed to fight against HIV and has adopted several strategies which include reduction of new HIV infections improving health outcomes and wellness of all people living with HIV infections, especially the youth, and other strategies include using human rights approach to facilitate access to services for people living with HIV/AIDS, and still most especially the youth. In conclusion, culture is a very important component in HIV prevention. Before one thinks of elimination, they should ask, why is it practiced? Culture is internalized and possesses a greater influence on how people will adopt any HIV prevention strategy. It should be noted that it is culture that will shape the health of the people and not the message of the awareness. Unless they incorporate culture, HIV preventions will continue to fail. Thank you.